Ever wondered what happens during a knee replacement surgery? Let's break it down in 60 seconds. First, the surgery begins with either spinal or general anesthesia. Your surgeon makes an incision to expose the knee joint. The damaged femur is carefully cut and shaped at precise angles to prepare for the new components. The femoral component is then attached to the femur using or without bone cement. Next, the tibia is shaved down and smoothed to remove damaged bone and prepare for the new part. The tibial component is then secured with either bone cement or screws. A plastic insert is placed between the components to allow smooth movement, mimicking the original knee cartilage. The new knee joint is tested for smooth motion, and the area is cleaned and closed up. And just like that, your knee is ready to move better and pain-free. Knee replacement surgery in a nutshell.